Good afternoon. Today is,
Yeah.
you always get me on. Today is Wednesday, April 3rd. This is the Finance Committee and we're going to begin voting. So who wants, which one? My analyst will start. Patrick's going to start with his bills. Thank you.
So we have a consent calendar of alcohol beverages bills. All local bills all have support of their local Senate delegations, and there's, I'm sorry, they're not?
No.
Okay, so there are some statewide bills on the list, but one statewide bill on the list. But there are no amendments.
No, they all passed.
And they all passed.
They'll pass the Senate unanimously and the committee.
Okay. So, does anyone have any bills they want to pull up? Does anyone have any bills they want to take off the consent calendar? This is the green page.
Oh.
I'd like to hold House Bill 1341 for further discussion. So if there are no other holds on that, except for House Bill 1341. Thank you, Senator. Do I have a second? Second. All in favor of the consent calendar, which already passed this committee, right? Already passed this committee simultaneously. All in favor of this consent calendar, please raise your hand. Okay, thank you very much. That's a unanimous vote. Now, House Bill 1341, I'm understanding that it wasn't a total delegation vote. Do we have anything about the vote on 1341?
I do not. I have a letter from the Senate delegation that lists both the senator from the 37th district and the senator from the 38th.
You have that.
I have a letter from the Senate delegation.
But
Perhaps
how about the House delegation?
I do not have the House delegation letter in the bill file.
Okay, it is a House bill. I'd like to have a letter from the House delegation. So
Okay.
we're going to continue to hold that bill. Thank you. Okay, is the blue sheet next?
We're onto the blue sheet, also a calendar of alcohol bills. So the first on the list is House Bill 335, which is similar to Senate Bill 45, which passed the Senate earlier this session. The bill alters the geographic area in the 45th Alcoholic Beverages District in Baltimore City, where a holder of a Class BD7 beer, wine, and liquor license may not sell beverages before 9 a.m. or after 10 p.m. and a license holder other than licensee specified may not sell beverages before 9 a.m. or after 10 a.m. and may not have hours extended if they begin later than 9 a.m. or end before 10 p.m. The bill needs an amendment to align the bill with the Senate cross-file by modifying the boundary of the alcoholic beverages district at issue under the bill. So that's what the amendment would do, reflect in the reprint.
The amendment makes it the same then as the Senate bill.
Yeah, the Senate bill will have matching language.
May I have a motion? Thank you. On the amended bill, Senator Ellis in a second. Second. And Senator Klaasmeyer is a second. So on House Bill 335 is amended, all in favor of this local bill? Senator Mounts? Thank you. Unanimous vote.
House Bill 587 is similar to Senate Bill similar to Senate Bill 561, which passed the Senate earlier this session. It authorizes the Frederick County Board of License Commissioners to issue a manufacturer's limited beer, wine, and liquor permit to a holder of a Class 1 distillery license or a Class 5 brewery license. The House amended the bill to prohibit holder from allowing patrons who are visiting any part of the manufacturer's licensed premises that is open to the public to enter the private event area while the private event is being held. And so that's the difference between this bill and the Senate bill. But I think the Senate bill is going to be amended to include this provision. So the motion to have the bills match would be to move this bill favorable.
Second.
Senator Ellis and Senator Glassmeyer, favorable in a second. All in favor of House Bill 587 as amended? Unanimous vote. Thank you.
House Bill 621, this is a Harford County bill. It decreases the license fee for a stadium beer, wine, and liquor license in Harford County. And the bill is introduced, it would have decreased the fee from $10,000 to $4,000, but the Senate delegation is offering an amendment to decrease the fee from $10,000 to $7,000 instead of 10 to 4. So that is the amendment that's being offered by the Senate delegation to this House bill.
And we do have a letter from the senators
Yes,
that's to support 7,000.
yes,
$7,000. So
correct.
can I have a motion on this local bill? Senator Ellis,
Favorable.
Senator Glassmeyer, all in favor of the Harford County local bill? Unanimous vote. Thank you.
House Bill 635 is similar to Senate Bill 734, which passed the Senate earlier this session. It establishes a performing arts nonprofit organization, beer, wine, and liquor license in Harford County. The amendment adds the executive director of the Alcohol, Tobacco, and Cannabis Commission to certain provisions relating to record keeping and reporting requirements. And I think a similar amendment is going to be offered on the Senate bill. So to move the amendment, the bills would then align.
So a motion is to move the amended bill, right?
Move favorable. Second.
Senator Glassmeyer and Senator Reedy, all in favor of the Harford County delegation bill as amended? Unanimous vote. Thank you.
House Bill 1052 is similar to Senate Bill 1100, which passed the Senate earlier this session. There are a number of provisions in the bill relating to allowing transfers of licenses, and there's some other things. There's a reprint here that shows some additional items that are requested for the 46th district. Essentially, they would authorize the transfer of 3 additional licenses. There's also authorization to issue new licenses in a certain geographic area, which I believe is Port Covington, and then there would be a prohibition on the transfer of a certain license. So the same amendments are being offered in the House that would go on the Senate bill.
Move favorable.
Senator Glassmeyer and Senator Ellis, all in favor of the local Baltimore City bill? Unanimous vote. Thank you.
House Bill 1089, this is similar to Senate Bill 904, which passed the Senate earlier this session. The bill authorizes the Baltimore City Board of License Commissioners to issue a Class B beer, wine, and liquor license for use by a restaurant in a certain downtown area. The amendment aligns the bill with the Senate cross-file by authorizing the issuance of the license in Ward 4 precincts 1 and 2 instead of in the downtown management district. Just the bills were drafted slightly differently, and so the amendment here would align the bills.
Move favorable. Senator Glassmeyer, Senator Ellis. Motion and second, all in favor of House Bill 1198.
1089.
I'm sorry, 1089. Unanimous vote. Thank you.
House Bill 1198 is similar to Senate Bill 1008, which passed the Senate earlier this session. The bill establishes a Class MF Municipal Family Fun Center alcoholic beverages license in the 40th Alcoholic Beverages District, and does some other things. The amendment is needed to correct a geographic reference in the bill so that it refers to West instead of East Biddle Street. So we need to move this amendment.
Move the amendment or the amended bill?
Move the amendment and the amended bill.
Okay, move the amended bill, House Bill. Thank you, Senator Ellis. Senator Klassmeyer. All in favor? It's a unanimous vote. Thank you.
House Bill 1235 is similar to Senate Bill 1079, which passed the Senate earlier. The bill specifies in Baltimore City that Class B D7 licenses issued for premises in certain locations in the Hamilton community must be considered unexpired for the purpose of transfer. There's an amendment here that would align the House bill with the Senate cross-file by specifying for one of the licensed locations under the bill requirements for the memorandum of understanding. So to have the bills match, this amendment would be moved and the bill would be moved favorable with the amendment.
Do I have a favorable with amendment on 1235? Senator Ellis, thank you. Senator Klassmeyer?
Yes.
Okay. Senator Ellis and Senator Klassmeyer, House Bill 1235, all in favor? Okay, thank you. Unanimous vote.
House Bill 1330 authorizes an alcoholic beverages licensee in Allegheny County to employ an individual who is 16 or 17 years old, as long as that individual does not sell or serve alcoholic beverages. There are no amendments being offered.
All in favor of House Bill 1330? Unanimous vote.
And House Bill 1377, Frederick County Bill, is similar to Senate Bill 1002, which passed the Senate. The bill establishes a Class DBR license in Frederick County and authorizes the County Board of License Commissioners to issue the license to a holder of a Class 5 brewery license and serve as the required on-premises consumption permit. The House made some technical changes, there are no amendments needed, but there are some technical differences, so that's why it's on this calendar. So the motion would be to move favorable.
Senator Reed? Senator Ellis? Thank you. All in favor of House Bill 1377?
Unanimous vote on House Bill 1377.
Another, these will go quick. Yeah. House Bill 1884 was a late filed Senate alcohol bill that authorizes the Prince George's County Board of License Commissioners to issue a Class B liquor license to a college athletic event venue on the University of Maryland Park campus. I believe this is for the Comcast Center. We don't have a letter yet from the Prince George's Senators. So you hold it. Okay. The next bill is House Bill 307. It's a local bill that is similar to the Senate Bill 9, which unanimously passed the Senate. The bill authorizes a Prince George's County Board of License Commissioners to issue a Class C fraternal sororal service organization beer, wine, and liquor license for use by an independent nonprofit nationwide fraternal sororal organization. The amendment in the bill conforms this bill to Senate Bill 9 as it passed the Senate. And it has a letter from the Prince George's County Senators.
Second. Senator Klassmeyer, all in favor of the local bill?
It's favorable with amendments. The next bill is House Bill 651. It's another local bill that affects St. Mary's County. It establishes a beer, wine, and liquor tasting permit in St. Mary's County and authorizes the Board of License Commissioners to issue the permit to the holder of a Class A license for on-premises consumption of beer, wine, and liquor for tasting purposes only. It specifies the fees for that. There are no amendments, and we have a letter from the St. Mary's County Senator.
All in favor of St. Mary's bill?
The next one is another St. Mary's County bill, House Bill 654. It's establishes a nonprofit performing arts theater beer and wine license in St. Mary's County. We have a letter from the St. Mary's County Senator in support.
All in favor of House Bill 654? Unanimous vote. Okay.
Okay, moving along here, House Bill 762 is another local alcohol bill. And for Montgomery County, it authorizes the holder of a Class B beer, wine, and liquor license to sell at the place described in their liquor license at retail or for on-premises consumption, beer and wine in containers sealed with the manufacturer's original seal for off-premises consumption only. There are no amendments, and this is also supported by the Montgomery County Senators.
I have a motion favorable and a second from Senator Kramer. All in favor of House Bill 762? Thank you. Looks like
Okay.
everybody's here now.
The next bill is not a local bill. This is House Bill 808. It establishes a local delivery service permit for third parties that authorizes delivery by a third party of manufacturers sealed alcoholic beverages from a retail license holder who is authorized to deliver alcoholic beverages to an individual in the jurisdiction where the retail license holder is located. There is an annual fee paid to the local board for this service permit of $1,000. Employees or contractors who deliver alcohol must be at least 21 years old, and a purchaser or receiver of alcoholic beverages under the bill must be at least 21 years old and provide valid identification proof of age on receipt of the alcoholic beverage. Delivery may only occur during the hours that the retail license holder is open. There are no amendments offered. The House did amend the bill to require that the Alcohol Tobacco Commission promulgate regulations.
Senator Washington, do I have a second?
Second.
Senator Ellis, beat you to it. I have questions. So I understand that this will have local regulation, that each local liquor board can decide if they want to do this or not.
Yes, this could only apply in counties where local retail delivery is already authorized.
Okay.
Or of course, that wouldn't stop a county from, doing it in the future, but
Right.
the local government would have to authorize retail delivery
Okay.
from retail delivery to people in the county.
So if I'm in Baltimore County and it's a different day, can I order something from Harford County and they can come in?
No, you cannot.
No, okay, that's all.
Okay, all in favor of, okay, we won't call it that. House Bill 808. It's basically enabling legislation for,
Kramer's not saying anything, so I guess.
And I
we'll-
hope she lets my bill out, she'll deliver it to me.
okay, it's unanimous vote. Thank you.
Okay,
Madam Chair, do we want to, pardon me, I don't want to interrupt,
No.
but we have a Senate bill do we want to move that simultaneously?
Okay,
you'll have to amend the Senate bill to conform to the House bill.
Can we do that?
so Senator Washington just motioned to amend the Senate bill to be identical to the House bill. Yeah, Senate Bill 456. And is there a second?
Second.
Senator Kramer, Senator Washington, Senator Kramer, all in favor of moving the Senate bill? Okay, thank you. Unanimous vote.
Okay. Next is House Bill 816. This bill, I'm expecting an amendment on which we haven't received yet, and therefore I don't have a letter on the amendment. So we're still awaiting an amendment from Prince George, an additional amendment from the Prince George's County Senators on this bill and a letter in support of the additional amendment. We don't have that yet.
Hold it until you have the amendment, right?
Mhm.
Okay, so
Or the additional amendment.
we're holding 816. All right. Next bill, David.
Okay, the next bill is House Bill 1269. It's a local bill from Baltimore County that clarifies that the Baltimore County Board of License Commissioners must publish notice of an application for the alcoholic beverage license 2 times in 2 successive weeks in one newspaper of general circulation in the county. However, if there's no newspaper, the notice requirement may be fulfilled by the board posting the notice for an application hearing online at least 14 days prior to the application hearing. There are no amendments, and we have a letter from the Baltimore County Senators in support.
Favor of House Bill 1269. Unanimous vote. Okay. House Bill 362 is Nathan.
Next bill is House Bill 362, which is identical to Senate Bill 531, which passed the Senate earlier this session. The bill establishes a barbershop and beauty salon, beer and wine, alcoholic beverages license in Caroline County. There are no amendments. There's no fiscal impact. The bill has the support of the Senate delegation.
I may be the lone.
Let's call the roll. Make some questions. Wait a minute. I had a motion. Who made the motion? And who seconded it?
I did.
Okay, so you had Senator Kaczmar and Senator Hershman. And who has the question? Senator Ellis.
So, is there, other barbershops and beauty salons in the state that have this
Yes.
already? Many, in many counties? All?
No, lots of.
Okay, all right, thanks.
So, let's call the roll. That's what I think we should do.
House Bill 362 favorable. Vice Chair Klausmeyer.
Yes.
Yes. Senator Kramer.
Yeah.
No. Senator Hayes.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yeah.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
Yes.
Yes. Madam Chair.
Yes,
Yes. 10-1.
thank you.
The next bill is House Bill 1340, which repeals the monopoly of the Liquor Control Board and its dispensary system for the sale and distribution of specified wine and liquor in Wacomico County. There are no amendments. There's no fiscal impact. There was no opposition at the hearing. There's a Senate delegation letter in the file.
And a House delegation letter?
There was a House delegation letter submitted in the House where the bill passed unanimously.
So all in favor of House Bill 1340? Wait a minute, I need a motion and a second. So Kathy moved a motion. And okay, Senator Ellis, your question.
So when it says, end the repeal of the monopoly, Nathan, what's the monopoly? Is it?
So in Wacomico County, the county dispensary system has a monopoly on the sale of certain wines and liquor. And this ends that monopoly. It would allow other retailers to be able to sell that in line with their licenses.
Does other counties have this monopoly? Does Montgomery County still have this or?
Yes.
Okay, and Montgomery is the only one that left, you think?
I believe that is the case.
Okay, great. Thank you.
All in favor of House Bill,
One to go.
Senator Mounts?
Just real quick, Madam Chair, we pulled the other bill for Wacomico. I have the House letters for later, just so you know. I have.
Okay, we'll go back to that then. Okay. House Bill 1340. It's all in favor? I think we need to call the roll. Oh, no, it's a unanimous vote. Okay,
All right.
we're gonna go back. Senator Mounts says he has the letter.
Yes, so 1341 is this is from the consent calendar. The bill is identical to Senate Bill 941, which passed the Senate unanimously earlier this session. And I would note that, yes, there is a House delegation letter in the House file, and the bill passed the House and the committee unanimously.
Does the House delegation letter tell us to vote? I mean, it doesn't need to be unanimous, but I understand it was maybe a little contentious.
My understanding in an email reply from the House sponsor is that the vote in the House delegation was unanimous and the vote in the House committee and on the House floor was unanimous.
Okay. All right, thank you. So we have a letter. Let's all in favor of House Bill 1341. Thank you. I'm sorry, I didn't write down who had the motion. Who made the motion? Okay. Senator Klausmeyer, you motioned, Senator Gao seconded, 11-0. I'm sorry, I missed that. I had a little distraction over here, my friend on the left. Sorry about that. All right. Now we're going to go to the yellow sheet, and I think we're going to start with Patrick. Okay. Senate Bill 681.
Senate Bill 681. This was a bill that was on the voting list for yesterday and was held. This is the one that requires the Department of Transportation to conduct an impact assessment for major highway capacity expansion projects. So Senator Lamb is actually offering a substitute set of amendments. From some feedback from the Department of Transportation, it appears that the requirements of the bill potentially could apply to the replacement of the Francis Scott Key bridge facility. And so what the amendment that he's offering to do is to exempt a project to replace the Francis Scott Key bridge facility from the requirements of the bill.
Senator Washington,
Can I,
you can, go ahead.
yeah, thank you, Madam Chair. I just wanted to say that I have all my answers, all my questions answered, excuse me. And, you know, it was noted yesterday that I only care about one particular project. But as we know by the amendment, there's multiple projects that this could affect. And I want to make sure that, and my intentions were always to make sure that it doesn't affect that some of these projects that are out there, that they affect, they do what we need to do for this bill, under this bill. And so I appreciate the sponsors of bill and what we're doing and the amendment. So thank you.
So I have a question, because when I read the bill, it says it doesn't apply to replacements, and it doesn't apply to anything that's already in process, and that's through the 5 or 6 year consolidated plan. So what does the amendment actually address?
Well, so the amendment you can see is on page 6. And so I don't think a replacement for the Francis Scott Key Bridge is docketed or, in the CTP. I mean, this is something that just happened. So when MDOT was looking at the bill, they said there is the possibility that this is a major highway capacity expansion project that would not fall under one of the exemptions in the bill. And so the amendment is being offered to make sure that it would.
Thank you for that. Senator Lamb.
Yeah, I think it actually would fall under one of the exemptions of the bill, which is system preservation. It's kind of obvious that if we're going to rebuild the Key Bridge, that's system preservation. I think the department is just wanting us to make sure that we carve very wide margins when it comes to the Key Bridge for the obvious reasons. And so, this was included as an amendment to kind of placate those concerns, which I think should be covered under the system preservation provisions already anyway.
Thank you. Senator Hershey.
Thank you, Madam Chair. I would just say, I think this is a further example that this is bad policy that we're passing here, that we are making sure that certain projects are exempted from what would appear to be, or what was explained to us as a very important piece of environmental legislation, but yet the concerns are about who's not included here. And again, this is just another example of that. If I could, I'd like to maybe put a floor amendment on that would exempt anything in my county from being having to go through this as well too, since that's what we seem to be picking and choosing which ones should not have to be subject to this intense environmental review that will, again, just provide the environmental community with another arrow in their quiver and trying to stop transportation projects. So it would be easier, Madam Chair, if we just did not vote in favor of the bill, and we wouldn't have to worry about whose projects are affected. Thank you.
Thank you, Senator Hershey. Senator Reedy.
I'm happy to support an amendment to make it clear that the Key Bridge isn't affected, but I am a little curious because I thought in the discussion yesterday, we were told that this isn't going to keep you from building anything. It's just they have to consider these factors. So why would we need an amendment to preclude anything if it's not going to keep us from building more roads?
Yeah, so I mean, it's to make sure that there wouldn't be a requirement that this type of assessment be done
on the bridge
project.
Why would it be a problem to do this kind of assessment on the bridge?
I mean,
okay.
All right, so do I have a motion let's do the two bills together, Senate Bill 681 and House Bill 836 as amended. Senator Lamb is favorable. Do I have a second? Thank you, Senator Washington. Tammy, will you call the roll, please?
Senate Bill 681 and the cross-filed House Bill 836, favorable with amendment. Vice Chair Klaus Meyer.
Yeah.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes.
The
Yes.
two highway bills, Senate Bill 681 and House Bill 836.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mouts.
No.
No. Senator Washington.
Yes.
Yes. Senator Guile.
Yeah.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey. No. Madam Chair.
Yes,
Yes.
8-3.
8.
8-3, the bill passes. Thank you. House Bill 223.
House Bill 223, also a bill that was held. This is the bill that exempts mortgage loans made by community development financial institutions from statutory requirements to verify a borrower's ability to repay the loan. And just for recollection, there is an amendment that's being offered by the House sponsor to apply the exemption in the bill to the interest and usury statute in the commercial law article, which is an additional subtitle that governs mortgage loans.
Do I have a second?
Second.
Senator Ellis, okay. Should we call the roll? All in favor of House Bill 223? All right, I guess we're gonna call the roll.
Yes.
House Bill 223, favorable with amendment. Vice Chair Klaus Meyer.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Hayes. Yes. Senator Reedy.
No.
No. Senator Ellis.
Yes.
Yes. Senator Mouts.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
I think we're gonna be back cleaning this bill up in a couple years, so I'm gonna say no.
It's a great bill. No, it's.
No. Vice Chair.
No.
Madam Chair.
Yes,
Yes. 9-2.
9-2, the bill passes. Thank you. House Bill 567.
We've got 250.
I'm sorry,
House
I'm
Bill
sorry.
250.
I'm moving too fast. House Bill 250.
So House Bill 250 is another bill that has been on the voting list previously and was held by Senator Hershey. This is a departmental bill that authorizes the Office of Financial Regulation to examine a third-party service provider as to the services and activities performed on behalf of an entity licensed or chartered by the Office of Financial Regulation within the Department of Labor. And then there was an amendment. I think the committee already adopted the amendments, actually. That to address some issues that were raised by the Maryland Bankers Association. Yep.
I'm just gonna say, I think the committee adopted some early amendments. I was looking at an amendment, but we were not able to work that out with the Department of Labor, so it's fine to keep the bill the way that it has been amended already.
Senator Passmeyer, motion, 3 seconds, second, Senator Hershey. All in favor of the amended House Bill 250? Senator Hayes, are you with us? All right. Okay, thank you. 11, it was unanimous. Okay, now House Bill 567.
Okay, so now House Bill 567, the Online Data Privacy Act. I've got a reprint in front of you. And what does this represent? This represents a set of amendments that are being offered, that have been offered in the House committee. This set of amendments would bring this House bill into alignment with the way the Senate bill is being amended in economic matters.
Okay, may I ask a question?
Yes.
All right, can we maybe cut to the chase and go to the bill sponsor and ask the question, does this bill sponsor want to conform to the way the bill is in the House, or do we want them to conform to the bill that you sent in?
This product represents a lot of work between both committees, and I think that it's a good product. I think that the House agreed to nearly all, would you say, Patrick?
Yeah, what I would say is that the amendments generally conform the House bill to the Senate bill, but with 8 substantive changes, which I will identify in the reprint.
Okay. Overall, I'm happy with the product.
So, so the first substantive, change is on page, or first substantive difference from the Senate bill is on page 3, and this retains a definition of biometric data as it was in the bill as introduced. It's more inclusive, but this was something that I think was viewed by the House as something that was important to retain. The second is on page 16 of the reprint, 16 of 37. And this is an exemption that was tightened up that relates to personal data that's provided to insurers. And so what this does is it exempts from the bill personal data collected by or on behalf of a person regulated under the insurance article or an affiliate of such a person in furtherance of the business of insurance. And the MIA was brought into some conversations in meetings with both of the chairs to work through some of these issues. The third change is on page 22 of 37. This House amendment flat out prohibits the sale of personal data of children versus allowing it if a child consents. So that is just a flat out prohibition on the sale of child data. The fourth difference is that the House had established some restrictions, and this is on page 23 of 37. They had established some restrictions on loyalty and rewards programs. The amendments here strike what the House had done, but then allow the offering of these programs provided that the selling of personal data is not a condition of participation in the program. So that was one point of discussion that was worked on between the two chambers. And then the fifth change is on page 24 of 37. And under the bill as introduced, it requires disclosure if a controller sells personal data to third parties, and the House favored an enhanced disclosure requirement for data that's sold or shared. So that's reflected here. So the disclosure must be prominently displayed and use clear, easy to understand, and unambiguous language to state whether the consumer's personal data will be sold or shared with a third party. So that's the fifth one. Then the sixth difference is on page 33 of 37. The Senate bill had altered a provision regarding controller or processor compliance with investigations. But what this does is retains this provision as it was in the bill as introduced, so that nothing in the bill may be construed to restrict a controller or processor's ability to comply with a civil, criminal, or regulatory inquiry, investigation, subpoena, or summons by a federal, state, local, or other governmental entity. On page 35 of 37, we had a liability protection for controllers when using processors or sharing data with third-party recipients. And if these third-party recipients violate the protections under the bill, this would have given some protection to the controller if they did not actually know, that the third-party recipient would violate the requirements of the bill. And one additional change is that there is an additional piece that was added that aligns this exemption with what is in the Delaware law, so that the controller gets the protection, the immunity protection, if the disclosing controller was and remained in compliance with its obligations as a disclosure of the personal data, in addition to not having actual knowledge that there would be a violation at the time. of disclosure. So the liability protection has been tightened up a bit to match what is in Delaware's law. And then the final thing is on the second to last page of the bill, and the House had adopted a severability clause. And so that is what is reflected here. So if any part of this bill is held invalid, the invalidity doesn't affect other provisions of the bill. That's it.
Favorable?
We have a motion and a second on House Bill 567. Can we vote? All in favor of House Bill 567? Should we do a roll call? No, unanimous vote. Thank you. I just want to thank number one, I shouldn't say number one, both our sponsor and our analyst, Patrick. It was a tremendous amount of work, hours and hours and hours. And I just want to thank you for all the work. I think it's an important bill, and I'm happy that we came together on it. So thank you very much for that work.
The next bill on the list is House Bill 1023. This is a bill that makes changes related to the Washington Suburban Transit Commission. It repeals the authority of the governing bodies of Montgomery and Prince George's counties to review and approve the contracts and agreements entered into by the commission. It also authorizes the WSTC, the commissioner that serves on the WMATA Board of Directors to be reappointed to the board, and then authorizes the Secretary of Transportation's designee to attend meetings of the WMATA Board of Directors on behalf of the Secretary when the Secretary is not available, instead of only if a scheduling conflict arises. There are no amendments, no opposition at the committee hearing.
Do I have a motion on House Bill 1023?
Favorable.
And a second? Kathy Classmeyer, Senator Classmeyer and Senator Guile, all in favor of House Bill 1023? Unanimous vote.
Okay, further down on your list is House Bill 97. This is a bill that is almost the same as Senate Bill 723, which unanimously passed the Senate. The bill requires, if you recall, the manufacturer of baby food beginning January 1st, 2025, to test a representative sample of the final product reached toxic heavy metal listed in the bill. This testing must be conducted by a proficient lab at least once per month beginning January 1st, 2026. You have an amendment. If you recall, when you sent the Senate bill out, you altered the definition of baby food, so you have to conform the House bill and add that addition to the of baby food. And also there's another definition change in the reprint. You'll see that the definition of proficient lab on page 2 of 4 is also altered. The House has made the same change to the Senate bill regarding the definition of proficient lab. So if you do this, you'll have identical bills.
Move favorable, isn't it?
Okay, so that was,
Second.
we had a second over there. Senator Kramer and Senator Guile, all in favor of House Bill 97? I think we need to call the roll. Okay. We're going to call the roll. You're calling the roll on House Bill 97.
House Bill 97, favorable with amendment. Vice Chair Clausmeyer.
Yeah.
Yes. Senator Kramer.
For the babies, yes.
Yes. Senator Hayes.
Yes.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yeah.
Yes. Senator Lamb.
Yes.
Yes. Senator Hershey.
Yeah.
Yes. Madam Chair.
Yes,
Yes. Unanimous vote.
For the babies.
somebody didn't raise their hand. That's why we called the roll. No, it wasn't you.
Okay, the next bill was on the list earlier and was held. This is House Bill 1122. If you recall, it requires a person to submit a request for acquisition to the Maryland Healthcare Commission and provide specify notice to the residents and staff of the nursing home as part of this process of acquisition. The executive director of the commission must review the completed request for acquisition in order to do one of four things: approve the acquisition with conditions, deny the acquisition, or refer the request for acquisition to the commission itself for a final decision. You have a reprint in front of you that has some corrective and clarifying amendments. If you go to page 4, you'll see that on line 11, it was an and, then it was an or, now it's back to an and regarding these two criteria. And then there's additional clarifying language. The bill originally said the facility is a nursing home, and it changes that to for an acquisition of a nursing home. The rest of the bill is unchanged, and it was the result of work that led by the Healthcare Commission, and there's agreement on all parties on the bill. You have an additional amendment in front of you from Senator Ellis, but that amendment has no effect at all on the bill sitting in front of you and its amendment. So you can I can go through this in more detail, or you can act on at least the bill and then consider Senator Ellis's amendment.
I'd like for us to vote the bill first because I know how much work has gone into this bill with these amendments. David has worked on it like the entire session to get it to the point where we could introduce the bill. So let's vote 1122 with the current amendments if we can.
Well, no, not the bill, but the
1122, the amendments for 1122.
Yeah, the amendments, and then you'll take up Senator Ellis's amendment.
Okay. Can I have a motion? Okay, thank you, Senator Ellis, and a second. Senator Kramer. All in favor of the amendments that are offered on the bill? Okay, thank you. That's unanimous vote on the amendments. And now let's talk about Senator Ellis's amendment.
Okay, you should have a separate packet in front of you for Senator Ellis's amendment. And just briefly, the amendment takes element of actually 6.5 of the state government article and applies it only to nonprofit nursing homes. And the key to the whole amendment is if you go to, and it only applies to the acquisition of nonprofit nursing homes, not for-profit nursing homes. And if you go to page 3 of 8 of the amendment, this is what I think Senator Ellis, and he can explain more about what he's trying to do with his amendment, but this takes at least 40% of the charitable assets that resulted from the nonprofit status of the nursing home, and then would put them into the Maryland Healthcare Trust, which it's already established, and that was designed to take some of these funds that come from public benefit for the acquisition of a hospital or a nonprofit health plan. And the trust is actually included in the back of this amendment because there's a change to that, reflecting that there could be funds coming from the acquisition of a nonprofit nursing home. But the idea of this amendment is to grab some of that public benefit that resulted from this being a nonprofit nursing home and put it into the trust. Senator could come.
Senator Ellis?
Thank you, David. Thank you, Madam Chair. So the issue is we have sales of nursing homes, nonprofit nursing homes happening in Maryland. One happened in my district. And you have hedge funds and private equity buying these nonprofit institutions. Now that's big because as a nonprofit, they do not pay property tax. They do not pay a lot of taxes that are attributed to for-profit institutions. They get grants from government agencies. So they get tremendous benefits from being a nonprofit. So when they convert to a for-profit, when they're sold to a hedge fund or private equity, there's a tremendous amount of money potentially that can come in to these institutions with no benefit to the community. So this amendment just piggyback on law that already exists for hospitals, where if you have a sale of a nonprofit hospital to a for-profit entity, these percentages and monies go into the public account. And so that's the idea behind this amendment. It took a lot of work, and I appreciate the work that they've done with this, work with drafters and, basically have a really good product here that will hold public funds accountable to stay in the public area from the benefits individuals have received from their nonprofit status over X number of years.
David, do you have any comments on the amendment?
It would be the 6.5 says just the regulated entity would have to do the work and ultimately determine that how much of this money would go or whether there were any of this at all would go. This would be put into the hands of the commission to also make this a determination in addition to the work they would do on the other acquisition too.
So we do have comments from the commission, and if a not-for-profit survives the acquisition, the MHCC, which is the commission we're talking about, will adopt regulations that require information from the seller about their plans regarding the disposition of assets. If we had concerns about whether the sale is in the public interest, we could approve an acquisition with conditions. The conditions could direct the seller to distribute the assets in other ways consistent with the public interest. If the not-for-profit does not survive the acquisition, the same rule would apply. Plus, if the nonprofit is dissolving, there are rules under the Maryland Code, Corporations and Associations 5-208 governing non-stock corporations about distribution of assets. The not-for-profit board will be bound by their bylaws and charitable purposes during the dissolution for the not-for-profit entity. Mr. Steffen says, I think the public interest requirement is a powerful and flexible tool for addressing Senator Ellis's concerns. If the scope public interest is defined in the regulations that would be adopted, should House Bill 1122 pass. So he's very concerned about this amendment after all the work that's been done on the bill with both the House and the Senate working together. And we don't want anything to happen to this bill because we've been working on this private equity buying nursing homes since 2020. So it's been 4 years to finally get to this point. So Senator Ellis, I was wondering if you would consider doing a bill next year on this issue, because there's not anything pending right now, I don't think, that would be a bill to address going forward what these nonprofits need to do.
Madam Chair, I will yield to your request and withdraw my amendment.
Thank you. And I will be happy to support a bill next year and work with you on that.
Yeah, thank you, Madam Chair.
Thank you very much. Let me announce, we're going to vote House Bill 1122 and Senate Bill 1000 as amended. Can I have a motion? Can I have a motion on the bills? Senator Hayes and Senator Reedy, all in favor of House Bill 1122 and Senate Bill 1000. Thank you all very much. Unanimous. Oh my goodness, you have 45 minutes.
No, you still.
Oh, we still have
you got
more?
a lot to go.
Oh, you mean I got to turn the page over?
Got to turn the page over.
You don't have to. Just come back tomorrow.
Okay, on the top of the list is House Bill 1388. If you recall, this bill would provide that under current law, there are certain employees who are prohibited to be subject to a non-compete clause in an employment agreement or contract. This would add anybody licensed under the health occupations article, which are healthcare professions, as well as anybody who is licensed as a veterinarian practitioner or veterinary technician under the agricultural article to that prohibition that a non-compete could not apply in any employment contract or agreement they have. You have a reprint in front of you with amendments offered by the chair. And we can go to page 2. And what it does is the amendments break out the veterinarians from the licensed healthcare professions. So if we can go through this, on lines 5 through 9, you'll see that the amendment specifies that it's employment for clinical services, so it would not apply to other employees of a hospital such as administrators. In a position for which the employee is required to be licensed under the health occupations article and earns equal to less than $300,000 in total annual compensation. So if you're a healthcare professional and you make less money, then there can be no non-compete in your employment agreement. There is no such income limit for the veterinarian practitioners or technicians, so they would just not be subject to a non-compete under state law. Going down further on line 13, there was language in here in the original law by protecting client lists or other proprietary information. This would add patient list to that. So if somebody is under a non-compete and they leave, they could not take just a patient list with them, a healthcare professional or a veterinarian for that matter. And then if you go down to further in the bill, it does authorize non-competes for a specific class of healthcare professional. So you'll see that if it's a healthcare professional for employment in the clinical services, again, in which the employee is required to be licensed under the health occupations article, a non-compete or conflict of interest provision in the employment contract or similar document or agreement may apply if the employee earns greater than $300,000 in total annual compensation and may not exceed 1 year from the last day of employment and 10 miles in geographic restriction. There's also an additional requirement on the employer that they have to provide a policy that provides notification of the patients of the new location where the former employee will be practicing. And I believe there's also at the bottom of the page, there is a language that requires the Healthcare Commission to hire a consultant to study the effect of private equity firms on healthcare and the details of and things they have to look at on the top of the next unnumbered page. And finally, it would apply that these non-compete criteria would only apply to employment contracts or similar documents for the healthcare professionals beginning on or after July 1st, 2025. And I believe the chair has a modification to her amendment.
Yeah.
Yes, in my
the 10 miles in geographic restrictions is a problem. But I would like to keep the 1 year from the last day of employment and just take out number 2, the 10 miles in geographic restrictions. If we can do that verbally. Are you finished?
That's the amendments.
Okay, so I see a question from Senator Guile.
David, can you just tell me what employment for clinical services, what that means?
The idea of that is to get at that, again, you're employees of a hospital. You're trying to talk about folks who are actually providing clinical services in the hospital.
Okay.
If that's not folks who are administrators.
Okay. Okay, thank you.
Senator Lamb.
It's the first that I'm seeing of these amendments, and it does give me pause in terms of breaking up, setting different standards for people that are caring for humans versus animals. I am concerned how this would affect specialists in the state, because it looks like this is intended just to target those folks. It seems to just be disproportional in who it's actually affecting. I do have some question about clinical services. Is someone who works in a lab in a hospital, for example, I guess that would be considered clinical services, or do they actually need to be caring for a patient? Somebody's a pathologist, is that a clinical service? If they're, doing autopsies?
Senator, do you have a different term to use for doctors that are actually seeing patients versus a doctor that's, say, the manager of the ED? Is there a term for, if it's not clinical, what is it for a doctor that's actually seeing patients?
I guess it could be direct patient care, but I actually don't like the amendment.
You don't like what?
I don't like the amendment. I think the amendment is problematic, but I think the other part about private equity, I think there's some value in studying private equity. I think there's some provisions that may be missing in the study. This is obviously, we haven't had a hearing on a study to study this more, but I think hospital consolidation, for example, factors into private equity. Hospitals acquiring private practices also affect, kind of the mix here of ownership when it comes to private equity. That's not addressed in the study too. If hospitals are acquiring physician practices, for example, there's just less physician autonomy, and there may be increased costs. And it can also potentially narrow access depending on how those private equity agreements are set up. That's not included in how the study is arranged either.
And I'm happy to talk with you more about the studies. The problem is the private equity firms though. And they come in and they buy up the practices. They don't necessarily provide the same quality of care that has been provided previously with a nonprofit hospital, because we know what private equity firms are doing. They're there to make money, right? That's why they're equity. They're making a profit. And so we often hear that the quality of care decreases when healthcare professionals join a private equity firm. We also have a different issue in Maryland. We've talked about, I think 12 states have eliminated non-compete for doctors, but none of those states have the waiver of the total cost of care, whatever you want to call what we do in Maryland, that no other state has but us. And so with the total cost of care, our hospitals do not have the money that other hospitals have to I don't want to say to hire doctors and open a clinic. They have to take that from their own funds, not from the healthcare, not from what's being paid for healthcare. So it makes us different than any other state in Maryland. And so my attempt on the amendment is to try and say, we want to take care of the healthcare workers, but for the highly paid and the specialists, they need to be treated a little differently because the investment from the hospitals is so great. And they need an opportunity. And that's why we put 1 year. Some hospitals have a 2-year. This would limit them to 1 year in non-compete. And only for professionals making more than $300,000 a year. So it probably wouldn't cover most of the healthcare workers. It would end up applying just to the doctors. But if you think there's more to be in the study, we can hold this till tomorrow and work on the study.
Yeah, I think there is more to be included in the study. I think, there's been a lot of hospital consolidation taking place. I think even despite the fact that we have a different system here, we have an all-payer system, there have been a lot of health systems that have bought up private practices as well. And so I think if we have a study that's going on, it ought to include a little bit broader of a purview to include consideration of hospital consolidation and how hospitals are also buying up practices, physician practices. And that I think should be part of the study if we're going to have a study as part of this. I think we already have a shortage of providers in the state. I think this provision to separate out specialists is only going to exacerbate that concern. And I just don't think that this is, going to help the fact that we don't see enough. We have a healthcare workforce shortage here.
Mm-hmm.
And, it's just going to make providers less likely to want to stay here.
Do you think part of our problem is we're in the bottom 28% of paying doctors? What doctors make in Maryland, we're in the lowest 28% of the country. Maybe that's why we have trouble keeping doctors.
Sure, I'd be always in favor of paying doctors more.
It's a problem. And, I look at the waiver sometimes, I wonder, I think it's great for the patients. I don't know how good it is for the hospitals. Senator Reedy?
It's interesting you should say that because I think the issue of private equity getting involved in lots of different things is a real legitimate concern. And despite my ideological belief of being more pro-business, I think it's fair to raise those concerns. But on the other end, if we're worried about people not being paid more in our state, we don't really have a competitive marketplace because all our hospitals are nonprofits. We have the waiver, and definitely that is a bigger conversation than today. But if you don't want private equity, well, they're coming in and they're paying doctors more. So like, what are we doing? I don't know that we can. I don't know if we can be too hard on private equity for paying doctors too much. So I don't know. I don't know if that's really not this bill, I don't guess, but.
Well, it's a bigger issue and hopefully this new ahead plan that their HSCRC is, we are going to be part of that. That decision's been made. So maybe that's going to change things some, but you know, we talk about how hospitals don't have the money, the funding to expand because of the all payer system. And, you know, we as a state are giving them the money that they need to do capital projects because they aren't making enough profit to do a capital project. I'm happy to talk more about this. If you'd like to hold it to tomorrow, Senator Lamb, that's your call. If not, I'll call for a vote today. Do you want to work on it with me? Okay, thank you.
So the next bill on the list is House Bill 306. However, this bill still requires a revised amendment and a revised delegation letter. So I understand that the chair is asked to hold House Bill 306 to the next voting session. Moving on then, as amended and shown in the reprint, House Bill 358 is identical to Senate Bill 151, which passed the Senate unanimously earlier this session. The bill establishes the work group on health and wellness in Prince George's County. The county health department must provide staff to the work group. The amendment, as shown in the reprint again, is clarifying. It alters the membership of the work group, aligning this bill with the Senate bill. You can see that change on page 2 in line 2. There is no fiscal impact.
Who's the second? Senator Reed. All in favor of House Bill 358? Unanimous vote. Thank you.
Next bill, as amended and shown in the reprint, House Bill 897 is identical to Senate Bill 896, which passed the Senate unanimously earlier this session. The bill establishes the Baltimore Convention and Tourism Redevelopment and Operating Authority Task Force. The amendments conform the bill to the Senate bill.
Motion table, have a Senator Hayes, who's the second? Senator Ellis, all in favor of House Bill 897? Unanimous vote. Thank you.
Next is House Bill 1304, which requires the Department of Health to develop a process for providing information about the availability of the state's earned income tax credit to enrollees and potential enrollees in specified programs and other individuals receiving specified services. And then the bill further requires the Department of Aging to provide periodic training to the Maryland Access Point Network and increase awareness of the availability of the state's earned income tax credit. There are no amendments. There was no opposition.
Second. Senator Kramer and Senator Plassmeyer.
All in favor of House Bill 1304? It's unanimous vote. Thank you.
Right. Coming now to House Bill 1056, which prohibits a 340B manufacturer from directly or indirectly denying, restricting, prohibiting, discriminating against, or limiting the acquisition or delivery of a 340B drug to a pharmacy on behalf of a covered entity that is defined in the bill with specified exceptions. A violation in the House bill as it was amended in the House is an unfair, abusive, or deceptive trade practice under the Consumer Protection Act and is therefore subject to specified enforcement action and penalties. So a violation is required to be investigated. The State Board of Pharmacy may impose certain disciplinary actions on a violator that holds a license or permit from the board. The bill may not be construed to be less restrictive than any federal law that is applicable to a person regulated under the bill, or the bill also may not be construed to be in conflict with applicable federal law and state laws and regulations. So the Prescription Drug Affordability Board is also required to conduct a study on the 340B program and the implementation and impact of the bill. Senator Klausmeier has an amendment that is reflected in the reprint Senator Klausmeyer's amendments do two things. So one, it narrows the definition of covered entities for purposes of the bill, generally excluding hospitals, unless the hospital were to receive certain federal grant funds. And then that first change that I described, by the way, can be found on page 3 of 5. And then the second change that's on page 4 in lines 7 and 8 narrows the scope of the bill's prohibition against limitations on pharmacy to be against pharmacies that are located in the state.
Pharmacies that are located where?
In the state, in Maryland.
So they have to be in the state, the pharmacies.
Yes.
Okay. So I've heard from some hospitals. Let me start with you all first. Senator Ellis, you have a question?
Well, I had the same, thank you, Madam Chair. I've heard from some hospitals also, and they want to be left in. And so.
Yep.
That's it. Thank you.
I want to clarify the amendment, for the federal entities, for the federally qualified health centers, are they in or out?
They remain in under Senator Klausmeyer's amendment. A
Thank you.
covered entity includes a federally qualified health center.
Okay, thank you.
So I'm just, I got a message today from one of the hospitals, it's Hopkins, actually, they were in seeing me about another issue. And they showed me on their website how transparent the use of this money is. You can go to their website and see exactly how they're using the 340B funds to help the underserved communities. And so I'd like to leave the hospitals in.
Agreed.
Agreed.
Move unfavorable on the amendment.
So the amendment doesn't do anything else then?
The amendment makes that other change related to the pharmacies being located in the state.
So I'm okay with that. But, so I don't know how we, Senator Hershey?
Thank you. Just with respect to Hopkins saying how the money's being used, or that's just one hospital. Are you seeing that with everybody else, or that was what
Well, I know
was
the
a
University of
concern?
Maryland does because I serve on the committee that looks at the community enhancement, what we do in the communities with the funding. So I know that
Okay.
I know how it's used. I don't know if it's as transparent as Hopkins that it's on a website, but it's very transparent.
Okay, and then I'm also trying to figure, I thought that this was something that was being handled by the feds right now, that they are trying to find a solution to this. You know, this bill, this is the first year this bill's even been in. I mean, is it that critical that we pass this bill this year when the feds are trying to get a solution that will work for everybody rather than the state of Maryland just trying to figure out whether this is a good idea or not?
If you remember, it really helps the small independent pharmacies and the federally qualified health centers. So, we're always looking for ways to try to help the independent pharmacies, and this is one of them.
We've been many years we've been dealing without it, so I just was
I know,
wondering if
but
the
they're
feds thought it was,
they're really struggling.
if it was
Senator
that
Lamb?
important, they do it.
Yeah, thank you, Madam Chair. So I'm just trying to make sure that I have this clear. There are amendments here offered by Senator Klausmeyer. But we are keeping all the hospitals in, right?
Right.
Under the provisions.
So the only thing, if we do that, then the only thing her amendment does is say they have to deal with an in-state pharmacy.
Okay. I guess in that example, what if there's, let's say, like a low income student that gets care at Chase Braxton, but they need to get their drugs at an out of state, or they go to an out of state like college or university?
Are they in the 340 program?
They would be if they went to like Chase Braxton or Healthcare for the Homeless or something.
I think that's a good point, Senator Lamb. Senator Reedy?
Can I just ask, you mentioned, because I've been reading a lot about this bill, and it's like the more I read, the more confused I get. And I sort of echo Senator Hershey's comments about should we be rushing to pass something this year? Should we look at this a little closer, maybe do some kind of study? And I'm not saying that in the traditional way that we always are like, we shouldn't pass this bill, let's do a study. I mean, I'm really confused. I'm a little concerned. I don't quite understand I've heard the same thing too. It's not good for the rurals or the small pharmacies are struggling, but I also have heard that some of the hospitals, there's some hospitals in the country, and I'm not casting aspersions necessarily locally, although this might be the case, they're setting up programs in places that are not needy and benefiting from the 340B program. I've heard that argument. I've heard the argument that we've talked about now. So what is the problem we're trying to solve with the bill? I think I was at another hearing when I missed the hearing, but I mean, I don't mind yeah.
So so just to kind of level set, the 340B program is a federal program that allows healthcare facilities that meet certain criteria of treating people in need to be able to contract with pharmaceutical companies for drugs at lower cost and be able to bill insurance for them. And so they're able to get the funding from that to be able to reinvest in the community and serving people. Right. So that's the federal program. And so it's open to all facilities that meet those criteria. That could be hospitals, that could be FQHCs or community health centers. What the drug companies figured out a couple of years ago is that they could, as part of those agreements, require the FQHC or the community health center to only direct their patient to one particular pharmacy. And that pharmacy may not be the closest pharmacy to that individual patient, but they're able to put that restriction in place as part of the contract that the drug company can require that of the provider or the healthcare facility that they've entered into a contract with to compel that patient that they have to use a particular pharmacy, and that pharmacy may not be the closest to that individual patient. This ideally should be fixed at the federal level because it's a federal program, but they're not able to fix it through Congress. There's no regulatory authority through the Center for Medicare and Medicaid Services to be able to address this at the federal level. And so what has happened since 2020, when some of these drug companies first started putting these restrictions and requirements in place into their agreement, is that states now have had to step up to say that if the FQHC or the community health centers enters into a contract with that drug company, they are not restricted in where they can direct that patient to go for their pharmacy.
Okay, and that all makes sense. As a counter to that, the only point I've heard kind of counter to that is that a lot of times the pharmaceutical companies are willing participants in 340B. It's probably good for them in some ways, but there are hospitals and other organizations, not FQHCs, but hospitals that are taking the reduced drugs and then we don't have any visibility on what the profit that they get from having cheaper drugs is going to. That's their argument. I mean,
and that's why the bill has
That's the argument that the pharmaceuticals are giving us, but have we actually found that to be true of the hospitals?
And I'm not saying it is.
But you know what I mean? There's no documentation.
So
I haven't seen it at Hopkins and I haven't seen it at University of Maryland. So who are the hospitals that are not using the funds properly?
Well, I think we don't know because there's no required reporting of how it's used.
But at the end of the bill, there is a required report.
Now, in this bill, there is.
In this bill now, there is a required report. And, just to be clear, some of these hospitals are in very rural locations too. So, and there are many areas that are considered sole community hospital or critical access hospitals, particularly in kind of the rural areas of the state, like UPMC, Western Maryland in Cumberland, St. Mary's Hospital in Leonardtown. There's another rural hospital in Hancock. So all of those are ones that would also benefit from being able to have these cost savings that they can reinvest into their community as well.
And are they doing it now though, or they're not?
They should be doing it now because that's part of the federal requirement. That's what this study will make sure that they're actually doing. So that's why there's a provision.
Okay, we got the study, but we're doing more on top of the study. Why are we doing this? Why don't we do a study and find out what's happening and then come back and do?
Because we know that the drug companies are already including in the contracts that they have with these facilities, including FQHCs, requirements that you can only have the patient go to one pharmacy. So that's what this bill does, to say that you cannot have those restrictions in place. This makes it easier for patients to be able to get their medications, especially ones that are low income, already going to community health centers, and also helps them, particularly the ones in rural locations where going to a particular pharmacy or being directed to a pharmacy may be very far away.
If it's a need of a specialty drug, however, I'm just going down the list of things that I've been reading about, so I appreciate the dialogue. If it's a specialty drug, it's an expensive drug. Pharmacies are providing this at a deep discount. I understand we don't want to send a patient 30 miles away, but a lot of times this stuff is getting mailed to them, isn't it?
It's not necessarily, it's not just for specialty drugs, and it's not always being mailed to them.
But this isn't, I bet this covers all drugs, this would say you can't really limit where somebody can get a prescription.
You can't, it brings it back to the status quo before 2020, when some of these drug companies started entering into agreements that required patients to have to go to a particular pharmacy. This gives the flexibility back to the patient, many of whom these patients are low income folks, they may be in rural locations and whatnot, to be able to go to the pharmacy that's closest to them to be able to get their medications.
Okay, thank you very much. Thanks for the answers. Thank you, Madam Chair.
So I have tried to request any hospital that's participating to show us the transparency in how they use the funds. Because I have doubts that that's a true statement.
Well, I'm not accusing anybody.
Well, but other people are.
Right, so
That's what I keep hearing from pharmaceuticals.
Well, it's easy for us to also always go after pharmaceutical companies. I'm all for it, but.
But how many times this year have we decided not to do anything about the pharmaceutical companies and prices because we're waiting on the PDAP? Everything's about the pharmaceutical. Every time they use that excuse.
Yeah.
Senator Mounts?
Thank you, Madam Chair. It would be in order to ask the sponsor a question about the bill. That is okay to do that right now. I missed the hearing, unfortunately.
Okay, no.
And I just want to make sure I understand, for the 340B, the pricing for the manufacturers, how does that, do you know how that works?
The 340B program is an optional federal program for drug companies to enter into to be able to have an agreement in place with facilities that care for basically people that are low income. And so it's voluntary. They don't have to participate in it. Most of them do, because that the state, for example, requires anyone who participates in 340B to be able to have access to Medicaid patients, right? So everyone wants to, the pharmaceutical companies all want to participate in that. And so that's the genesis of the program. It's really to be able to provide individuals that are low income going to these facilities already and seeing these providers to have access to reduced cost medications. And the providers can also bill insurance that will have them use those cost savings and plow that back into their local communities and those that they serve.
Yeah, and so I understand by prohibiting any limitation on where you can get those pharmaceuticals, if you were to open it up, then that means there would be more of these drugs available. Therefore, the cost for the manufacturers would go up because there would be more access to the pharmaceuticals. Is that an accurate understanding?
Not exactly. Before 2020, we're just trying to restore the status of this program to before 2020. Since 2020, the drug companies have added stipulations to their agreements with the federally qualified health centers, community health centers, and some of these hospitals to say that the patients can only go to one pharmacy. And that pharmacy may not be the closest pharmacy. They're basically putting restrictions on access. They're putting some limitations on it. And that pharmacy may not be the closest for that patient. They may not be the most convenient for that patient. And there's nothing that the federal government can do to roll those provisions back as part of the agreement. So it's been left to the states then to set up their own laws to say that practice of having to require a patient to utilize one particular pharmacy would be prohibited. That was the practice before 2020, before a lot of these drug companies have figured out that they could mandate that requirement.
So is the cost of the pharmaceutical at the independent pharmacy going to be the same cost as the retail chain pharmacy? So I'm understanding exactly what you're speaking of. I mean, this is our district. So are the independent pharmacies then going to be able to compete in this market with some of the larger retail pharmacies?
Yes, it shouldn't affect the cost. That's why I think in the testimony, there's positive testimony, supportive testimony from like Epic and the independent pharmacies.
Right. Okay. Thank you.
So Senator, if you don't have anything else to do tonight, you can go back and watch the hearings in the House and the Senate. And I think that, I really think the House hearing was a better hearing. I don't know, maybe I just didn't remember the Senate hearing that well, but it is available online. Senator Hershey?
Thank you, Madam Chair. And again, if I could ask the bill sponsor, just when you were just talking about, I'm trying to see, who are the hospitals actually contracting with? The pharmaceutical companies directly? Or are they contracting with somebody else?
I'll have to check on that.
Okay. I don't know, Madam Chair, I mean, we were talking about a couple things and it's been mentioned that we're trying to reduce prescription drug costs. Obviously, this is a plan. I'm not saying that the pharmaceutical companies initiated it, but they're certainly involved in reducing drug costs. So I think that's a good thing. You know, it's a good program. I do like your idea of seeing, you know, how anybody is spending the benefits of this program. I mean, I think we all want to make sure that it goes back into the community as it's supposed to. And it sounds like, you know, a couple of the things that the sponsor had mentioned about potentially being directly directed out of state. I think, you know, the amendments that are here that says that they must go to a pharmacy located in the state probably also makes sense, considering, again, this is a federal program and we're going to make some tweaks to it. I think that you know, using pharmacies located in the state would be beneficial to Maryland businesses as well.
I think though Senator Lamb made a good point. You could have college students that need to be taking certain medications and they're out of state, their school's out of state.
Yeah, I'm sure we could find, you know, all kinds of examples that might not be exactly it. But if we're talking about the broader policy and it was questions about using many out of state, I think we could set the policy that way. And, you know, if a student needs to do something, they can give us a call.
Thank you.
Thank you.
Senator Lamb.
I guess just to answer that very briefly, you know, there are parts of particularly rural parts of the state in Western Maryland where the nearest pharmacy might be in a different state. But I think it's also important to bear in mind that the reinvestment still has to be where the facility is. And so while that patient may be going to an out-of-state pharmacy because maybe they're close to the border and that's actually close to them, the reinvestment, the savings that needs to be reinvested into the community is where the actual provider is, where the FQHC is.
And that's what we wanted to verify.
But they have to, because that's federal law.
We're going to need to hold the bill. The bells are ringing and the president made it clear he wanted us there at 5. So we're going to hold the bill. Yep. Yes, Senator.
Before you run to the floor, you're second on a bill that this is you've already done this. This is the bill is House Bill 92. It's the cross file to Senator Carter's Senate Bill 620, Resources Education for All Prisons REAP Act. The EEE committee amended the House Bill 92 to be the same as Senate Bill 620. So,
Motion to concur.
well, motion to favorable with amendments.
Do motion and second. Seconded. Go. Okay, thank you. Motion and second. All in favor? All right, see you on the floor.